So thank you guys for joining us tonight. We're really excited to have two special guests on this December webinar today. So for this week, for this month, we invited Nicole Rosen and Susan Brasher, and I'll introduce them, to talk about some of the findings from a project that is called the Next Gen Sibs. And so you guys as adult siblings, you may have children yourselves or thinking of having children or not thinking of having children. You may have other interests and needs for support. And no one's really kind of asked you in a formalized way what you need. So we held two focus groups, or Nicole and Susan held two focus groups, one out of California and one out of Emory, but they were virtual, so anyone in the US could participate, to gather input on perspectives of the siblings about their own future, their family's future, their interests in science and research and services and support. So they are here this week to present it. I'd like to welcome Nicole Rosen. Nicole Rosen is a predoctoral fellow at UCLA. She used to work at the Peers Clinic, which is an evidence-based parent-assisted social skills program for anywhere from preschoolers to young adults with ASD. She's now in Kathy Lord's lab looking at the impacts of family dynamics and the roles of siblings and sibling relationships. And we're so thrilled to have her back, because she did talk about some of her data that she collected kind of like in an earlier meeting that we had of Sibs Stick Together. Our other guest is Susan Brasher, who she is actually a pediatric nurse, and she's also an assistant professor at Emory University. She has a PhD in nursing from University of Florida and is now a PCORI, which is the Patient-Centered Outcomes Research Institute ambassador, after working on several projects and being a PI on a couple of projects around patient-centered or person-centered outcomes research, specifically about community members addressing health disparities in young adults with autism. So I'm going to go ahead and stop sharing my screen and invite Nicole and Susan to tell us about what they found. And we would love your perspective and your input and your thoughts about not just the original questions, but also what was shared in these focus groups. So take it away.
Well, thank you for that introduction. Really appreciate it. And I think I can speak for Dr. Brasher and myself. We are very excited to share some of the findings from this study and really discuss and really keep this open for discussion on what the next steps might be, what everybody thinks could be kind of a helpful next phase based on what we found. So without further ado, I will, let's see. Okay. Is everyone able to see the screen? Yes, perfect. Okay, so we'll go into kind of some high-level findings, and then we'll also get into more of the specifics and talk through what we found and what we think some future directions are related to research and also kind of clinical services. So as Alicia mentioned, I'm Nicole Rosen, and I'm here with Dr. Susan Brasher, and we are thrilled to be giving you some insight into what we're calling We Asked, You Answered, What Do Siblings Need, based on this Next Gen Sib study. So I think I've talked about this and I will nail this in more than probably everybody would like, but as this audience really knows, siblings are incredibly important, and the sibling relationship is particularly important. We know, especially in ASD, where that lifetime kind of sequence of difficulties we know is pretty common. And so a sibling relationship, which usually lasts a lifetime, is really unique in that it really can kind of span those difficulties, and that sibling can be present to support the autistic sibling throughout the lifetime. And we know that siblings occupy many roles within the sibling relationship, and that these roles change. And so we think about these roles when they're younger, like a play partner or a conversation partner, friend, kind of teacher support system. And then that this role kind of changes as we're now thinking about adulthood, where sometimes this sibling becomes a caregiver or some type of kind of support system guardian in that next phase of life. Just as a kind of brief highlight on what we know about the sibling impact, we know that siblings can have really profound positive impacts on their autistic sibling. So we see benefits in adaptive functioning over time, social functioning. We see some benefits in nonverbal communication skills, theory of mind abilities, and all this really relates to how siblings can impact the development of the autistic individual. But we know that it is a two-way street. It's bidirectional. So both the sibling and the autistic individual are undoubtedly affected in different ways. And we need research to really understand how to support both sides of this relationship. And that's what brings us to this study, the Next Gen Sibs project funded by ASF, where we're really thinking about the siblings and thinking about you all and how we can better support Sibs in this relationship. So when we think about sibling dyads, I know we've talked about this a lot before, but this term of unaffected sibling is really a misnomer because there's no such thing as an unaffected sibling. We know that growing up with an autistic sibling undoubtedly affects your life and how you navigate life and how you grow up and play together. And it also affects kind of things that happen during adulthood and what you might be thinking about and planning for. So this study, we're really looking at the question from one generation to the next, how does autism affect you and your family? And just some numbers to get us oriented, and keep in mind these numbers are ranges and we get new data every few years, but autism prevalence and recurrence plays a big role in this conversation where we're talking about this next generation. So thinking about those who have diagnoses, about 1.5 to 2.8% of children are diagnosed with ASD based on the recent CDC study. 10 to 20% of siblings of autistic individuals also have ASD themselves. And then this final piece, thinking about that next generation, we see about 3 to 5% of individuals with an autistic aunt or uncle will also have ASD themselves. And this is who we're thinking about as that next generation, the children of the non-affected siblings of autistic people. Oops. So this study, we really had 4 aims. So we really wanted to engage typically developing adult siblings and their spouses, if they were interested, in focus groups to discuss their experiences having an autistic sibling, their thoughts and feelings about how having an autistic sibling has impacted their expectations for the future, thinking about specifically decisions related to parenthood, and also their attitudes towards research and willingness to participate in future research. So we have officially wrapped up this study at UCLA and Emory, where we have been conducting focus groups and individual interviews. So from UCLA, we recruited from our existing longitudinal study and from community partners across the US. And then Emory University recruited from the Autism Center. And total, we had 7 focus groups and 5 individual interviews. And I will now pass it over to Dr. Brasher to discuss our analytic approach for qualitative data.
Thank you, Nicole. So how we conducted these focus groups and interviews were, as Alicia mentioned earlier, was through Zoom, which was a great benefit, especially during this post-pandemic, constant pandemic situation, that we were able to gather all these siblings virtually through focus groups and interviews. And during that time, for the focus groups and interviews, we recorded them and then we transcribed them verbatim. So the recordings were sent away, and what we got back were these transcripts with just the words that were able to de-identify and take away some of those siblings' names so that we would just see the information that they said. And so once we had those transcripts, then we went through a team of coders, and we had a pretty diverse team of coders where there was 4 of us, including a sibling of an autistic individual, a neurodivergent researcher, a qualitative researcher, and a clinical psychology researcher. So that way we could have a well-rounded team and reduce some of the bias as we were coding this information. So I use MaxQDA, which is a qualitative software where you can feed in these transcripts, and then it allows you to code what people are saying, and then you can group those codes into categories. And we came out with 2 main categories of all the different codes. So a total of 1,370 codes. So that there's a lot to be said and a lot of information. And I'm going to share some snippets of that with you all today. So a total of those codes then were grouped into 2 categories of future directions, where siblings want us to head in the future. And within that had many subcategories. And then lived experiences, where they talked about their lived experiences from when they were a child, ranging all the way to now that they're adults and their sibling is an adult. And then additional codes were 108 really great, in our opinion, rich quotes that we really wanted to have their words represented whenever we were sharing the information. And so that's kind of what our code book broke down. And so I'll go further, drill down deeper into that for you guys. So here you can see just a snapshot of the code book of the lived experiences with autism. You can see some people talked about homeschooling, not many. And then some people talked about the impact of the pandemic. And then when we start talking about family relationships, all of these codes fell within this family relationship. So we heard from siblings their feelings towards parents. We heard about the communication that was in their family growing up, is that they, quote, didn't call it autism. We heard that some families had very little support. We also heard that parenting preferences and how the parents approach certain situations and their styles really did impact the siblings and that dynamic of the family relationships. And then we heard more about the family dynamics. And so each one of these little carrots you can see here, it will go down to further subcategories, but would group there. We heard about some siblings that grew up in a household whose parents went through a divorce and how that impacted their lived experience and their family dynamics or their family relationships. Then we heard, and you could see on this side of the screen, this is where you see all the numbers. This is how many instances, thank you, Nicole, since you're the one sharing the screen, is that this shows you how many instances that somebody mentioned that and talked about that. So relationships with siblings, we had 250 occurrences alone where they just talked about their relationship with their sibling and then further categorized into that. And so you can see these are just some examples of the family relationships, but each one of these categories went further into great detail. And so it really gave us a great insight to their family relationships. But down below family relationships, you can see another part of that lived experiences was how experiences shaped the future. And so there was 241 instances in which a sibling talked about how that lived experience of autism and their family relationship really shaped who they were moving forward and in the present. And then we also heard some co-occurring conditions that siblings were sharing that they wanted to express as well, and how those co-occurring conditions, and whether it be seizures or diet related. And so these co-occurring conditions then also affected their family relationship. So we learned a great deal. This is just one snapshot of parts of what we learned, and I'll share a little bit more with you on the next couple slides. So some of the overarching themes and the takeaways that we learned is that the experiences varied widely across and within the sibling relationships. And so it really did have a lot of variability. And some of the ways in which it varied is that we heard from siblings that had a sibling, an individual that their sibling had higher support needs. Their lived experience was a little different for somebody that had a sibling that was living independently and had lower support needs. And so those lived experiences were a little different. But because our sample was very diverse, we were able to catch a lot of these different experiences across the spectrum. And the parenting approaches, as one can imagine, really did affect the family relationships and their lived experiences. And so how parents approach certain situations or didn't approach a certain situation, such as that didn't talk about autism, our siblings shared with us how their experiences there, but not everybody had the same experience. So together, all these experiences made up a very well-rounded picture. And then the physical distance in adulthood was another one, is that some siblings said their sibling was living with them, and they were maybe living with their family, or their parents might have been deceased and they're living with their sibling alone. And then in some cases they were living independently, whether it's the autistic individual was living independently or the sibling had left the house. And so the amount of physical distance in adulthood did change that experience. And so for families that still were living together, their experience was a little different than somebody that was living alone in California and only saw their sibling on the holidays. And so we heard a great breadth of these different experiences. But one of the main overarching themes that we really heard during this process is that what we call the paradox is that siblings really talked about, and at times it was contradictory, but it was these complex perspectives as it's not a binary good, bad, like always great, always bad, but it was really this complex perspective related to the hardships that they experienced either throughout early childhood or adulthood. But then they would share these very personal experiences and these perspectives that were quite hard at times, but then would be counterbalanced by an overwhelmingly positive reflection of how those experiences shaped who they became personally, professionally, romantically. And so they shared in great detail some of their lives now and where they're heading because of this experience that they had had. So it was really something that was really complicated, as you all know and can imagine. So what did we hear? One of the things, and I have this in quotes because this is a quote from one of our participants, is that they really talked about what they said is the invisibility of autism, and that they said that it's really, there's so many inadequate research, services, education, and support specifically for siblings. So they talked a lot about feeling as if they had been overlooked or they are being overlooked in these different domains here, and that they wish that there was more research that was driven by siblings or even involved siblings, and these services that could be extended to siblings, and the education that siblings wish that they had when they were growing up or wish that they had now as they were taking on conservatorships and they were looking through trusts and things like that. And then same for the support, is that there was a high need for support, not only when they were younger children, which is oftentimes what we think about support groups for younger siblings, but as Alicia said, what a great opportunity that they're developing right now and hoping to get more funding on is how do we extend that support across the lifespan for siblings is what we heard. And so we heard there's a lot of this inadequacies in these areas. And then the siblings spoke directly to where we need to go in the future in these particular areas, but with a sibling's perspective in mind. And so they really wanted to show how can we drive these areas forward in our future directions. So the next couple slides, I'm going to share some of those. They're quite lengthy lists, but it's really, in my opinion, it was really just great information. So I thought we would share that with you guys today, is that when it came to research, the siblings were very eager to participate in research and be heard and be seen. They wanted to hear more about some of the genetic considerations that maybe they need to keep in mind as they were building families. The databases came up and they weren't thrilled about having a database of information about siblings because they thought it might be skewed, is that everybody who would opt into a database would be a sibling of maybe one cross section. And so they thought databases might not be representative of all siblings' perspectives, because as we heard, we saw a lot of different perspectives. And then there was no desire for invasive research. And so when there was talks about collecting blood, or even while somebody was pregnant and having amniotic fluid, or these types of procedures were not of interest to siblings. They did want to see more research on co-occurring conditions and autism. And then they also were interested in hearing about medication responses over time and how those change for their sibling and what could be done about that. Then they mentioned the sibling themselves had co-occurring conditions and diagnoses, and wanted to hear, do other siblings have similar co-occurring conditions and diagnoses? And then spouses was one, as Nicole mentioned, that in their sample, they included a couple of spouses. And in that focus group where spouses were included, and even the ones that didn't include spouses, we heard a lot like, my husband would be here or my partner would be here tonight, but they didn't feel comfortable talking in front of a group. And so what we heard is that they wanted to hear from the spouses, but they wanted that to be done in a more private way through a one-on-one interview or a survey that would be anonymous. And so, as you can imagine, a lot as these adult siblings are really thinking about what it's like for adults and transitioning to adulthood was a big also concern of area of needed to be researched. The barriers to getting involved in research, they talked about only certain families are getting to participate in research, and what can they do to reduce some of those barriers. The impact of sibling achievements and life course came up as well. Some siblings thought we should maybe consider look back at videos for early signs that they felt that we could maybe detect as early as less than 6 months if we were looking at home videos. They wanted to know what it was like for their autistic sibling when it comes to sensory. And so they wish that there would be some kind of research that would give us some insight to that. And then behaviors and meltdowns over time was another one. Is that does it get better? Does it get worse? And so what does that look like for autistic individuals? And then some siblings were interested in enrolling in research even before, like prenatally, like when they were having children, they wanted to be participating in research. So these are just some examples. And then we heard the services and where we need to go with services, as they mentioned early monitoring for all children, but especially a sibling's children. So if a sibling is having children as they're going through their well visits and very early on through their developmental milestones, they really wanted somebody to pay particularly close attention on their son or daughter. There was also a need for high-risk professionals, in their words, as they refer to these professionals that really worked with families that had a higher genetic risk, and centers that would really focus on siblings. And as siblings are having children and as their children are growing, they wanted to make sure that they had adequate screenings and somebody was monitoring their development very early on. Healthcare coverage and services was a big problem, as well as that a lot of the services, it wasn't equitable for some families. And so what could we do about that? Accessing regional centers and consortiums, as well, is that some parts of the country have really great regional centers and consortiums, but they're not always easily accessible. And so ways to improve access to those services. And then we heard some unique perspectives of ways in which we could bring services to the communities through libraries or churches or schools and community-based organizations, and people in the community helping to connect with services. So navigators in the community was another way that would help siblings and families navigate through services. And then there was a big list of education, that there's a lot of education that needs to happen, and that the siblings felt very strongly, and I didn't mention this earlier, but these are rank ordered in the amount of siblings that prioritize this. And so one of the bigger ones that we saw under education is open communication and transparency and family. And so that when siblings felt that their parents and their families were very transparent with the autism diagnosis and really discussed that was something that was really important to them, versus the siblings that said they wish they would have had that because in some families they didn't call it autism. And so they felt very confused as to why their sibling was engaging in therapies in the living room. And they just felt it could have been a little bit more transparent. The caretaker transfer is that, as how do we make that seamless, and what education? So we heard overwhelmingly a lot of adult siblings were wanting to know more about executors and trusts, and what happens when my mom or my dad passes away and I have to assume the role of the caregiver. And they really felt a big need to have some education on that. Overcoming stigma was also another one of education that they wish they would have had growing up as a sibling. Increased likelihood of ASD is if there is an increased genetic, racial, and gender risk, which is what the research is showing right now, and wanting to have more information on that data, and then how that could potentially inform their family planning. And if not inform it, then they felt that they would just like the education to be knowledgeable about what to expect. Knowing the signs of autism early, the siblings felt it was really important for them to be educated on that, and that they lacked some knowledge on that. And the social awareness of autism in society, they felt that society really was just not as knowledgeable as they should about autism, and they really wish other families and children growing up were more knowledgeable. And they felt they spent a lot of time themselves educating other people, and that can also be exhausting and daunting. And so how can we better support them to educate others? And so the medical community needed some education and training. the developmental milestones outside of just autism in general, signs and symptoms, or signs, if you will, that to show that they wanted to know that if their child was meeting a milestone or not in cases of other intellectual or developmental disabilities. They wanted that information. And so these are just some of the other examples here of the advocacy in the medical setting of how do we help siblings and how do we help individuals to advocate in the medical setting, especially as they're aging. Prenatal education was also important to them. The communication challenges that sometimes that they experience, they wish they had more information of how to better connect sometimes, especially earlier on with their sibling. And so I think over time, everybody falls into their communication patterns, but early on, they wish somebody would have sat them down and given them more education about the communication challenges and ways to overcome them. And then what does the autistic individual's trajectory look like? And we all know that trajectory varies widely and is different for every individual, but to have some education on the possible trajectories would be helpful. And then professionals on demand would be very helpful, that if they needed, for example, somebody to talk to about a trust or an executor, they wish that there was a pool of professionals that they could, perhaps in a center where they could access those individuals and ask them questions. And then employer education was to be more supportive and inclusive of their autistic adult sibling was really important to them. And then what they termed as prenatal risk factors, predictive of autism and ways to reduce factors. And so thinking about, we're not quite sure on the environmental implications right now with autism. There's thought to be many environmental implications, and they wanted to hear more about what would be some of those risk factors that maybe they could potentially avoid. And then support was a big need for support. You can see how it ranges from siblings really wanted to have support, and they wanted to feel included and have attention in the support groups, to hear from other siblings so that they didn't feel alone. They wanted some reassurance for some of the feelings that they were feeling sometimes, which are difficult to express. They wanted to have other siblings to say, I felt that way. You're not a bad person, or you're not alone, or I know that can be frustrating. So they wanted some reassurance. How to handle the aggression of their autistic sibling was another support of how do you navigate that. And when there is a lot of aggression of a sibling, then how have other siblings handled that? And they felt very confident that insurance needs to pay for the sibling support groups, and that it shouldn't be something that we're having families pay out of pocket. So again, that equity and access to support was there. And then a lot of need for, as their sibling is aging, and so how do we help navigate that process? But especially if that sibling is of higher support needs, those families were really wanting to see, is this something that they would move in with them? Is it something that they would move back home to? Is it something that they would live in different support facilities? And so they wanted to hear how do you navigate that aging process as caregivers are also aging. The school supports was another thing that came up, that they wish that the siblings themselves had mentioned that they've been pulled out of classes sometimes to help their other sibling. And so that was just one example of how siblings felt that there was better school support, and with teacher training and inclusive classrooms and system-wide support, really. The transition to adulthood, as they're making that transition, wanting to have more of a timeline of when to transition and how to transition, and sort of if their sibling is ready at that time and when are they ready. They wanted more discussion and support around that. And then interventions outside of what we hear a lot is early intervention. Yeah, definitely can relate to a lot of things. Thanks. And we want to hear more in case there's more out there. But these, the interventions that we hear a lot of, very few of them are respite. And so respite for the siblings, respite for the caregivers. And so sometimes they just want a little bit of support in that department. And then children with ASD and different levels of needs again came up, is that it was a very broad spectrum within our sample of some siblings had high level support needs and some did not have very high levels, and everywhere in between. And so for those, especially with those different levels of needs, how can we support those children? And then parents, they suggested parents needed support, prenatally support, mental health and trauma. Bilingual families came up a pretty good amount as well. And families in general having a support system, and then grandparents having a support system to how to support a child with autism or an autistic sibling. And so how can grandparents be brought into that to support? And so then we heard a lot about the navigation, and so where the need for this, where that education, the resources, and the support, that where all of those intersect, there's a great need for navigation of all of those different places, because some of those definitely inform the others. And so they talked a lot about needing a roadmap of resources and support. And so like, where do I go and what's available in my community, especially with ASD, with aging adults, and transferring that living situation, whether they're going to go live independently or to a group home, or whether it's going to be residentially. And so how do we navigate that process, which requires education, it requires resources and support. So all of these different categories all required education, resources, and support, and the need to navigate them. And so we heard a lot about their own life dynamics. And so if they were getting married or had recently been getting married, or if they're planning for kids, and what does that sibling care responsibility look like in the context of their own relationships? And then what about the work responsibilities? And so if they have work responsibilities, how do they balance that with their sibling and the life dynamics in general? And then the parental mental health came up. And so for parents that are experiencing depression and needing emotional support, and so that education and resources and support for them. Financial came up quite a bit, and that financial is a big mystery to a lot of families of how do you navigate that, and when do you navigate that, and how do you set up certain accounts, and then how do you transfer those accounts as people are aging. And then peer navigation was another one that was mentioned that would be very helpful to have other siblings helping to navigate, because other siblings are going through the same or a very similar experience that they are. And so what we heard, back to that invisibility of autism, is that when you don't have research and services and education and support and navigation, you live in this space they described as the invisibility of autism. And they talked about the medical community. They lack adequate training on ASD, especially less obvious signs of ASD, which leads to later diagnoses, and families sort of trying to navigate their dynamics. Treating individuals as more than just their disability was a good quote that came up. And so how do we train our providers, our medical community on autism, but then also engaging with autistic individuals in a way that is seeing them for all their strengths, and so a strengths-based approach versus a deficit model. And then how can they tailor treatment options to autistic individuals was another concern and a need that is much needed. There was a great discussion around the entire spectrum. So our siblings felt very strongly that the spectrum is often overrepresented on individuals that have very little support needs. And so especially for those families, those siblings that were on the call that had siblings that had significantly higher support needs, they didn't feel that part of the spectrum is represented really well. And so that left them feeling, that they didn't have enough support and that they really felt left out. And expanding training to other professionals more than just the medical community to make sure we're having a well-rounded model for this. Overcoming historical mistrust and issues of diversity, equity, inclusion. And so for our families that come from minority backgrounds, and how they have some historical mistrust, and how that continues to go forward today, and how there is that need for more visibility of that as well, especially within autism. And then as adults are aging and they're losing services, they felt that was not as transparent as it needs to be. And so a lot of families felt surprised that they did not have the coverage that they used to, or their coverage went away. And so they felt there should be more about that, more visibility about that. More visibility about the stigma as well, and that how families encountered the stigma and how that shaped their lived experiences. And then the need for greater representation and research of siblings and autistic individuals themselves was something that they felt really was lacking, and wanted to be more visible in those spaces as well.
Thank you, Susan.
Thank you.
Okay, so now I think the goal with these next few slides are really to zoom out a bit, to group these into broader categories of what we can do, kind of think of this in a slightly bigger picture, because we know that those lists, there's a lot that we need to do. And clearly those are just the thoughts of 44 siblings and a few spouses, and clearly the need for services and education and everything are extremely high, and they span a very broad range of needs. What we're kind of thinking about here is different topics related to those key takeaways. So we'll first be thinking about sibling relationships, and we're thinking both in the past, so during childhood, and current, so as they're in their adulthood years. So a big takeaway generally was that sibling contact decreases over time from childhood through adulthood as parents maintain or assume that primary caregiving role. And so this, we're thinking about sibling contact in the form of face-to-face communication, so in person, messaging, video chats, Skype, FaceTime, all of those types of communication that seems to decrease over time. But what's interesting, and I think what we would expect to see, is this pattern changing as parents become older and might need more assistance from siblings in supporting the autistic individual, and eventually some siblings taking over that caregiving responsibility. We also relatedly talked about many common barriers that kind of made it difficult to spend time with their autistic siblings. And I think the most unsurprising piece of this, and as Susan mentioned, physical distance played a really big role. It was the most highly endorsed barrier. As siblings grew up, they moved away from their autistic siblings for family, jobs, other reasons, and that, of course, makes it difficult to maintain contact. Second was social barriers, and this kind of refers to difficulties engaging with the autistic sibling, and this can be due to communication challenges, attentional difficulties, other challenges that just make it difficult to kind of connect and have that relationship. And then third, we saw many siblings talk about some safety and behavioral concerns. And this, we're thinking maybe when this autistic sibling is aggressive, maybe some self-injury or aggressive towards others, eloping behaviors, things that are just require more care and concern for the safety of them and those around them. And so that played into the amount of time that these siblings could spend with their autistic siblings. And if we have time at the end, I have a lot of slides that are very specific kind of quotes that relate to each of these that I think are really representative of the feelings of a lot of the siblings, but said from the perspectives of specific ones. So next, we'll talk about the second takeaway, and this really related to questions where we wanted to know, what are your earliest memories of autism? Kind of what did you first notice was different maybe about your autistic sibling? What were the things that felt different compared to other kids, or what really stood out to you when you think about your childhood? And these were the main responses for the earliest memories. They fit into kind of these 5 categories. So the first being professionals or providers in the home. A lot of siblings mentioned that they would randomly have adults coming into the home weekly and playing with their sibling and doing different activities and giving them really nice one-on-one attention. And with that came kind of confusion of, why is my sibling having all these strangers come into the home, but also some kind of jealousy of, why is my sibling getting so much attention and I don't have that? What did I do wrong? And what is happening? Why is my sibling getting all this help or all this attention? Is something different And I think that kind of ties into what Susan mentioned with just this lack of transparency in a lot of the families of the siblings who participated in our group. Repetitive behaviors. So we saw a lot of our siblings talking about specific behaviors like lining toys up or banging toys, or kind of remembering that their autistic sibling would engage in really repetitive behaviors that were very obviously different than what they saw their friends doing. Some sensory needs. We saw a lot of our siblings talk about how their autistic siblings would maybe rub their face on the couch, or really prefer certain textures, or be really aversive to certain textures, really high sensitivity to sound, and have difficulty kind of being at restaurants and needing to adjust their family schedule and activities to fit with the sensory needs of their sibling. We heard about emotion dysregulation, self-injurious behaviors. So some siblings mentioned some really kind of obvious signs that something was different when their sibling would have these really intense outbursts and have a really difficult time coping with whatever was going on, or small changes. Self-injurious behaviors was a big thing that was especially concerning to a lot of siblings. And communication difficulties. Why am I trying to talk to my sibling and they're not responding, or I'm calling their name, they're not answering? Those types of communication difficulties were really pronounced. And then we think about family planning decisions. So something I think that really surprised us was that many siblings were unaware that familial recurrence risk for autism extends to that next generation, or just the increased likelihood of autism extending to that next generation, which would be the siblings' own children. And I think what made this, or what made me at least pretty surprised by this, is we had a group of siblings who were, there's a response bias, of course. So these siblings were pretty highly involved in their autistic siblings' lives. Education levels were pretty high in these siblings. And this kind of lack of knowledge of what the genetics kind of show was surprising, but also in some ways not surprising, because I think we haven't done the best job of communicating this research in a layperson way, and kind of giving access to people outside of this research field. And while this was surprising, it was also a nice, tangible, feasible target for professionals and researchers and groups that are trying to disseminate research to the layperson. And it was a nice target for us to be able to better support siblings in providing this education. Genetics and probability of ASD recurrence, that was something that we talked about. The siblings mentioned that this type of information factored more heavily into their decision to have a second child, but not really that first child. So what we found is that many siblings stated that if they knew that they wanted to have children of their own, they were going to have children, or at least try to have children of their own, regardless of the increased likelihood of autism. And this was in part, a lot of them kind of discussed this uncertainty in our research understanding of what the genetic likelihood is. Our percentages span a really big range. They were not able to give them a specific probability based on their specific situation. And for a lot of the siblings, they had mentioned that uncertainty of how likely it is, it just doesn't, it's so uncertain that wouldn't factor into their decision to have one child if they were able to. But what would happen is when they were thinking about having a second child, many siblings did state that they would be more interested in thinking about the genetics, in part because the decision to have a second child would now not only affect them and their partner, but it would also have an impact on their first child. And so thinking about how maybe knowing the difficulties that they experienced growing up with an autistic sibling, they were more conscious of how their first child would be potentially impacted by having a sibling on the spectrum. Participation in future research was another big category of takeaways, and kind of the final consensus was really that all siblings were interested in participating in future research. And that was really exciting to us because I think we have a lot of things that we would like to learn from these siblings, and a lot of them expressed openness to genetics, behavioral, cognitive, as long as it wasn't this really invasive type of research. Research topics of interest and kind of how we can help. We were thinking about what kind of the questions were related to what can we do to help? What would you like to know? And a lot of these siblings mentioned wanting more information on how to take on that caregiving role for their siblings. So they talked about before they really think about taking over or having children of their own, they want to solidify their plans for taking care of their autistic sibling if that's a choice that they wanted to make. And things that they mentioned as part of that kind of paperwork or legal things that they needed to get a hold of and have control over would be things like transferring guardianship, navigating Social Security, accessing funds and trusts and wills, housing options, and luckily ASF, Els for Autism, and Sam Sibs have done a really nice job with, if everybody hasn't seen it, check out the previous webinars on some of the legal information from the most recent one and some transition planning. I think all of those are really helpful and at least in part stemmed from what siblings said in this study and in other studies, just of wanting this information to know how to proceed. And just for the sake of time, I'm going to skip over this video, but this is a participant who was willing to share about caregiving information, but it really is summarized in what we just talked about.
Dependent.
Okay. So some other siblings discussed this need for information on how do I support my autistic sibling when I'm thinking about that transition to potentially living with me. So we know that this transition can be really difficult for all parties involved. And they were some of them mentioned things like the dementia research. So in dementia research, some of the siblings were stating that it's most helpful to start that adjustment period of transition before things really come to a time where we don't have a choice anymore, it has to happen, and more of this slow progression of transitioning them into the home. So things like, okay, if my autistic sibling's our parents are growing older and they're no longer able to take care of the sibling, maybe we start having my autistic sibling come to my home a few nights a week, or have a sleepover at my home once a week to really get my autistic sibling more comfortable with that and slowly get to that transition period so that when it really does happen, at least we've been kind of preparing them for it. But there's also kind of concern about, is that the right way to handle this? We don't have research to show what's the best way to prepare for this. How do we explain what's happening to the autistic sibling? How do we make that transition as smooth as possible? How do I help my own family if I have kids of my own as the sibling? What do I say to my own family to prepare for this transition of my autistic sibling coming to live with me? Lots of concerns of just how do I navigate this process, because there really isn't research to explain it. Also, siblings expressed wanting to know about the trajectories of development in autism. And so thinking about, if my sibling is really aggressive right now, will this continue into the future? And this is really important for preparing for this potential transition of caregiving, because if you have, as a sibling, young children of your own, and your autistic sibling is demonstrating a lot of aggression or self-injury, how do I make that decision to bring my autistic sibling into my home when I have really young children? Is it safe for everybody? Am I able to give as much attention to my autistic sibling to ensure that they're safe, to ensure that my own kids are safe? Lots of questions about what is my future or my autistic sibling's future going to look like. The spousal perspective. So we had a few spouses who participated both in the focus groups and then some individual interviews with their spouses who were siblings of autistic people. And the big kind of takeaways from their perspectives, they mentioned wanting information about signs of atypical development, those red flags. And when we think about it, I think from the perspective of people who are so well-versed in the autism community and are so much a part of this community, when we really think about it, a lot of these spouses are coming into this community and this tight-knit circle and really don't have the information on how to kind of get along with somebody with autism, how to interact with them, how to communicate. What does autism look like? What is autism? And so really kind of this basic understanding of what are the signs that I would be looking for when I don't have personal experience with autism. How do I connect with the autistic person? So my sibling or my spouse has an autistic sibling and maybe they have difficulty communicating. How do I develop a relationship with them? Because I want to have a relationship with the whole family. And we heard a lot about just difficulties developing that and having that positive relationship. Support for parents. So thinking about how do we support the parents of the autistic sibling in transitioning out of that caregiving role. And then also how to kind of support themselves and their spouses as they take on this caregiving role, or as they just navigate the difficulties that come with supporting an autistic individual as they age. And our final one, advice for, we asked things like, what if you could ask or tell your younger self or the next generation of siblings who are in your same shoes any advice, what would you say? And there were a lot of things that they mentioned, but some of the big ones related to being open about your own needs and recognizing that it's okay that you have needs as well, even though it's clear that maybe the autistic sibling is also in need of help. It's still okay and it's valid that you also need help, and to be open about that need and to not feel guilty for taking support or time away from your autistic sibling because you matter too. Asking the questions and being part of the conversation, keeping that open line of communication to really understand what's actually going on. And also learning strategies to connect, because we know that there's it's a spectrum of communication needs. And so being open to connecting in different ways that might be unique. So we heard a participant talking about how they would make certain sounds, and that would be the way that him and his autistic sibling would connect. They just make certain sounds back and forth, or they'd go to the zoo together, or go outside and watch the trees and listen to the wind. Just different ways of connecting and really exploring those different avenues. So I know we're almost out of time, so just wanted to give a special thanks to our incredible sibling participants, the research team, and ASF for making this research possible. And I will leave it here and open it up to any questions in the remaining time we have. And if anybody's interested, happy to share some of the specific quotes that come with each of these different categories that I think are particularly interesting at a different time.